I'm good. How are you?
I'm good, thanks. So today, Zarina, you have room 12C.
Okay.
It's Mrs. Mioto. She does have osteoporosis, and she's a really high falls risk. She's full code, and upon admission, she was a 2-person ceiling lift because of her hip fracture. Our plans today are to change that.
Right.
She's been cleared by the doctor, and she's now full weight bearing, so we're going to start to begin ambulating her. So our goals for today is just to discuss future plans with her on getting her moving. We're going to try to incorporate the OT as well, and then also provide her some resources when she gets discharged. She's planning on going back home, so we're going to try to try to facilitate some home supports for her when she gets home. We talked about previously and how important mobility is and physiologically for the patient and emotionally as well. So she is really on board and motivated to start learning and start moving, and I think that it's so important that we get her moving as soon as we can. So we're going to start doing that today.
Oh, perfect. The only thing as a student that I'm a little uncertain of doing is creating a complete plan with her about her goals.
Yeah.
And I was wondering if you could come into the room and maybe just assist me with it a little bit, see if I'm going in the right track while I facilitate some teaching with Miss Mioto.
Yeah, for sure. I can be right behind you. I'll let you kind of facilitate it, but I'll be right there to guide if
That's
needed.
exactly what I need.
Okay.
Good morning, Miss Mioto. My name is Zarina. I'll be your student nurse today, and this is Brianna, an RN, who will be helping you while I provide you some care. How are you feeling today?
I'm okay. I am feeling a little bit discouraged though.
Why is that?
The nurse that was caring for me yesterday, she made me feel a little bit incompetent.
How did she do that?
Well, I was expressing to the nurse that I am looking forward to finally going home. I have been in this hospital for a couple months now, and I would just really like to regain my independence and just go back home. But when I was telling her about this, she told me not to get my hopes up too much, as I am an 80-year-old woman, and since I have fractured my hip, I'm probably gonna end up just going to a home because I probably won't regain the independence that I once had because of my age.
Well, I'm really sorry that you've experienced that, but we're actually here to tell you how proud we are of the progress that you've made, and you've done really well with your recovery, and we've heard some good news from your doctor about how you'll be able to bear some weight on both legs. And we're actually here just to discuss some goals about your mobility, because we were wondering if you were okay if we brought in the OT to maybe start helping you walk with your walker.
Yeah.
We just think it's important that you start mobilizing, even if that means getting out of bed and going to a chair for lunch or dinner.
Sure.
Okay, awesome. Why don't I go grab the OT?
Oh, great.
Good morning, Miss Mioto. My name is Paige. I'm going to be your occupational therapist working with you today. I heard that you're ready to start moving today.
Yeah.
So your doctor has actually ordered you that you're totally able to weight bear, and we'll do it nice and slowly so that you're comfortable with all the stuff that we're working with, whether we get you in your chair or if we're able to get you up and using your walker. That would be awesome too. How do you feel about that?
Yeah, that sounds good. I am a little bit nervous though.
Okay, what are you nervous about?
Oh, just getting up and walking because I haven't walked in a couple months since my fracture.
Okay, of course, that's a total valid concern, and you know what, I'm not going to be alone with you. We're going to have your nurse and your student nurse working alongside, and we'll just do it nice and slow, just at your rate, and if you're uncomfortable with it at all, we can totally stop and come back to it later, okay?
Sure.
And then after we've worked with you for the day and gotten you up and moving a bit and you feel comfortable, we will look up some resources that we can find for you for your home support, okay?
That sounds good.
Perfect.
Thank you.
I'll come back with the nurse.
Sure.
Hi, Mrs. Mioto.
Hi.
So Zarina, Paige, and I are just here. We're going to discuss some plans with you for the future, the next couple weeks. We really want you to regain your independence and get home as soon as you can. So is that something that you'd be interested in?
Yeah.
Okay, well, we're gonna recommend that you do at least 2 days a week of physiotherapy, whether that's with us or at your home. We want to test your ability to weight bear, and then if you're able to do that, we'll get you up and walking once it's safe to do so, and we'll all work together to make sure that you're safe, and we'll do it nice and slow at your own rate, okay? Do you have the ability to access physiotherapy at home for when you do go home?
Yeah, I can, there's a physiotherapy place I think I can go to that's close to my home.
Okay, perfect.
And what about your social supports? Do you have friends or family that will be there for you when you need it once you return home?
I do have children, but they do live in Vancouver. And I do have friends here, but you know, they're all quite busy and I don't really want to be a burden to them. They have a lot going on.
Well, a good option for you would be for us to maybe look at some home supports for you. And that'll just consist of a healthcare provider coming in and checking on you maybe weekly and seeing if you're okay, and if there's anything that you require assistance of, they can totally provide.
Yeah, I think that sounds great. I think with my recent fracture and my fear of falling, I think that it would be beneficial for me to have somebody come and check in on me and help me if need be.
Okay. We'll work on those supports and getting those supports in place for you once you return home. And now we'll just look at getting you mobilizing so we can get you to that place, and we'll make sure that the staff are all on board to get you there.
Okay, thank you.
Yeah,
Sounds
you're
great.
welcome.
Okay.
Okay. Hey, Serena. Hi. Hey. How do you feel like everything went today?
I think we did a really good job. I did want to ask you, however, about the information that Miss Mioto shared with us about the nurse who was taking care of her.
Yeah.
I just felt like the way that Miss Mioto described it, it made it seem like the nurse wasn't very respectful or ethical at all. And I was thinking of telling that to the PCC, but I didn't know if that was the right person to go to.
Yeah, no, I would highly recommend it. I was going to talk to you about that too. I think it was really unethical, and I think the best person probably to talk to would be the PCC for sure.
I'll definitely do that then
Yeah,
before
awesome.
I end my shift. Thank you so much.
No worries.